My turn. Okay. Hi, everyone. My name is 𝐾𝐬𝐬. I'm also a manager here, and I'm a graduate from Canada, so I graduated here, one of the universities here, and wrote my exam many years ago, and have been working in management in the last couple of years. So management, I just want to say in regards to OSCEs, MCQ, EE, the concepts in management are very related to how are you in that, if you're the manager, like in this case that we're about to go through, or you are the pharmacist in that situation, you are thinking of the patient in front of you and what is the best way to manage with this patient in front of you at that time, not just clinically, but even how to communicate with them to get them on the right, maybe clinical path, get them to understand the point that you're making, maybe consider different cultural or ethical perspectives, different backgrounds, because in Canada we have so many different cultures here, and you have to work, to understand all of them. You're working, depending on where you're working with different healthcare professionals, different, nurses, doctors, physiotherapists. Like you could be on a family health team, you could be in a hospital, you could be in a pharmacy, many, many different things. So these skills outside of the clinical, which I know Dr. have alluded to earlier, are the ones that are also tested in different ways in the management sections and will come through in your OSCEs as well, okay? So knowing all that, let's dive into the first question. So you are a pharmacy manager at a hospital, and you noticed that the order entry errors reported has increased last year. So the information required to verify that the error rate has increased should include what? And this question stem is presented a little bit differently on purpose. So there are 3 options, 1, 2, and 3, and then you choose from A, B, C, or D based on 1, 2, or 3. So option number 1 says number of pharmacists and technicians, changing the number of pharmacists and technicians in dispensary. Option 2, changing number of prescriptions or the number of prescriptions entered during the time specified. And option 3, the rate for all previous years. So who thinks that it should be A, number 1 only? For anyone. There's no wrong answers, as Nadine said.
Yes, I think B is the correct answer too.
Okay. And your thought process is similar or different to Ahmed?
I think staffing levels may explain why the error rate changed, but not necessarily they are required to verify that the error has increased. So that I excluded the number 1. So I think no, D is the best choice here.
Good. So yes, D is actually the correct answer because, as you both said, number 1 is not relevant to any of the data verifying here. We're just looking at data itself. So we need to see number of prescriptions, and then we need to see what errors have come up relative to the number of prescriptions, and this is how we verify the data in this case. Okay, good. I'm glad you're thinking along the right lines of excluding as well. So that's good. If you don't mind, you have next slide. Thank you. So now, based on the same question, a preliminary review is completed to confirm that the error rate is in fact higher than the previous years. So although the number of orders did not increase, you found that the staffing to workload ratio increased recently. So now what can you as the pharmacy manager do to reduce the order entry error? So here are some proposals. 1, creating order sets for computer order entry. 2, computerized physician order entry. Or 3, increased staff. And then you see the options there. So what do we think is the right answer? Anyone? No thoughts on this one? No wrong answers? Amir, please.
I think that D could be the right answer because both the computerized entry by the physician and increase the staff could reduce it.
Okay. Good thought process. Okay. Any other thought processes? No? Okay. So actually, and I appreciate your answer, Amir, the actual answer is actually C, 1 and 2. Why? Because they focus on more sort of technological system changes rather than just increasing the staff. So I know that increase the staff to workload ratio is part of the question stem, but in the management courses, we will discuss about how we want to have more system related changes as one of the highest error prevention strategies, including introducing more technology compared to just relying on staff and relying on manual checks, as it were. Because the more staff you have, the more you're continuing the same process technically, but we want to, in an ideal world, diversify the way in which we check and enter as well. So anything automation related would be a preferred answer in a question stem like this, although of course increasing staff could help, but in this particular choice of options, C would be the right one, okay? Did you have a question, Amir? I couldn't tell if you just raised your hand or not.
Thank you, I get it.
Okay, perfect, thank you. Next question, please. Okay, so based on the same concept, the review has also demonstrated that ISMP guidelines, so these are the Institute for Safe Medication Practices, the ISMP guidelines were not being followed during recent years. So which of the following from these lists of medications could have contributed to the increased error rate. So amoxicillin, 225 by mouth TID, vitamin D, 800 units by mouth daily, hydromorphone, 0.5 milligrams by mouth every 4 hours PRN, or methotrexate, 20 milligrams PO weekly. And what do we think of this one? Any thoughts? I'm not sure if anyone is familiar with ISMP guidelines, and it's different kinds of guidelines than the clinical guidelines here. No? Kyrillos? Yes, please.
I think D would be the best choice.
Why?
It's about the abbreviation MTX. I think it should not be used as it can be confused with other drug names. So, and also methotrexate is a high alert medication. So, I think it is the best choice.
Okay. Thank you for your answer. Anyone else want to share their thoughts? Okay. So yes, Kyrillos is 100% correct. Thank you, Kyrillos. So methotrexate or any drug abbreviations are highly, highly discouraged by ISMP guidelines. There are many abbreviations, not just drug ones, that are discouraged by ISMP, but definitely high alert ones such as methotrexate, as Kyrillos pointed out, are even more discouraged than normal compared to other non-high alert drugs that are abbreviated. So if this is how the orders are being written in your hospital and coming through, and person A is interpreting it as methotrexate and person B is interpreting it as a different drug, this is one of your big contributors to order entry errors as well. Okay, so great, good, thank you for that. Okay, next one. Okay, so now that your investigation is complete on these errors, you are planning an in-house educational presentation for your team, so the pharmacy team, to help improve the process. All of the following should be completed when creating the presentation, except, so this is except. So A, reviewing the latest ISMP guidelines. B, going over the summary of the investigation, your investigation with your team. C, proposing changes to reduce the error rate. D, highlighting which types of healthcare professionals are making the most errors. So what do we think here?
I think it's B. I think it is B. It's correct one, except B.
Except B. Why is that, Ahmed?
Because I must review the last guidelines with the team for the answer of A. Also, told the team that changes to reduce the error rates. Also, number D, or D, highlights which types of healthcare professionals are making the most errors to make a prediction in the future. Okay, so I think that the B that is the correct one, or the exception.
Okay, and for Kyrillos, what do you think?
I think I would do all of the above except B.
Except B, did you say as
D.
well? B? D?
D, the last answer, yes.
The last one, okay. The reason?
I think this creates some sort of blame instead of just a culture which focuses on identifying and fixing system issues. So I think I would do all of the above except D. I wouldn't highlight which types of healthcare professionals are making the most errors. I think I wouldn't do that.
Okay, understood. Anyone else have any thoughts? Going once? Amir? Yes.
I agree with D also, because it's not important who do the errors, just the errors is the most important things for us.
Okay, good. Okay, so the correct answer is actually D, the last one. Why? Not only for the reasons that you guys described, which are correct, it's not necessarily relevant, even if you have that data somehow, to point it out in a presentation in a way that may or may not come off to those staff as being very accusatory, like, oh, you're saying all of us, all the doctors are making the errors, it doesn't feel good. So one of the key concepts in management as well is working collaboratively with different healthcare professionals. So one of the things, even if you do somehow have this data, would be not necessarily to present this data in this way, but to say something like, oh, I see maybe physicians are choosing the wrong thing, abbreviating too much, we can't read their writing, whatever, and then it's leading to errors. So what can we do to help the physicians? Maybe we can automate, maybe we can pre-print things for them and all they have to do is check something off, right? The computerized order entry systems, things like that. So when you're presenting your options, you have to keep in mind also your audience, and you want to exclude things that may cause how do I say, like animosity to develop within your different groups that you're presenting to.